Hello and welcome to Askimo TV. I'm talking today to Saghar Kasiri. Saghar is a senior clinical embryologist and PGD coordinator at London Fertility Centre, Harley Street. She's been a specialist in the field of embryology for 18 years and worked in top IVF clinics in the UK. Saghar has made 4 TV programs on infertility, been interviewed by BBC, and written a number of articles on infertility and assisted conception techniques. Hi Saghar, how are you?
Hi Joanne, thank you very much. I'm well.
Great. Saghar, today let's continue our discussion about IVF, in vitro fertilization. So I'm going to begin with, is the IVF procedure painful?
Well, I guess with any procedure that is introduced and you go through seeing doctors and going through some tests, I think that there are 2 things really here. There's the physical pain that you can feel and also the emotional pain of it. I think the emotional pain with infertility and going through procedures like IVF is perhaps more for majority of ladies than the physical pain. We women are quite used to sort of going through a lot of pains through menstruation and birth and so on. And fertility treatment certainly is not going to be worse than those. Yes, there will be some pain involved, obviously, perhaps after an egg collection, because the ovaries are punctured with a needle to get the eggs out. But the patient will be given very good painkillers, and it shouldn't last more than a few hours. And with the embryo transfer, obviously, it's a very simple technique. Usually there isn't a lot of pain involved with that.
Will the IVF technique damage a person's ovaries?
No, neither IVF, retrieving the eggs, nor, for example, doing laparoscopy, whether it's vaginally or using a laparoscopy, should damage a woman's ovary.
Yeah. What if a patient ovulates before an egg or ovum retrieval?
Unfortunately, if that happens and the patient has ovulated before we have managed to retrieve the eggs, there isn't a lot that can be done. But one thing the patients need to bear in mind is that when they come through to IVF clinics, they're looked after by a very good team of professionals, that are doctors, nurses, embryologists, that are very well trained, and that the patient is monitored very closely by having continuous blood tests, by having a various number of scans, to make sure that on almost a couple of days basis, we know how well the ovary is responding to the drugs and at what stage it is and how close it is. We also regulate the release of the egg, as we call it, by giving a drug called HCG, which then it gives us a window of time of around 36 to 40 hours for the egg collection. So we can, because we basically shut down the woman's ovary during IVF and we control it from outside, we can actually have a lot of access and know exactly when we should go in for the egg collection. So hopefully the eggs should not be released before we do the egg collection.
If an egg is not retrieved, or if the technique does not produce a pregnancy on the first attempt, how soon can the procedure be repeated?
Sure. If it's been a stimulated cycle of IVF, because some patients go through natural cycles as well. Natural cycle of IVF, where they're not given drugs to produce more eggs, they can be done within the next month or so, basically literally within their next cycle. However, if they go through a stimulated cycle of IVF, because of the fact that we shut down their own ovaries and give them hormones to produce a number of eggs, more than one, we advise that the patients wait for a good 2 months or 2 cycles before they come through for their next treatment. This is to allow the body to go back to a natural sort of state, and then their own ovaries and their hormones start sort of going back to normal before we start another treatment cycle.
And how many times will IVF be repeated per couple?
We aim that it's not repeated very often, because we like our patients to get pregnant as quickly as possible. However, there is no limit on the number at all. Obviously, it depends on the patient's age. It depends on the patient's problem. If, for example, the patient is not producing eggs, then that patient may think about, instead of going through IVF using their own egg, they might want to go for donor. There is no upper limit. We have patients that have been through perhaps even 10, 12 times for IVF, that, you know, have tried, they've been successful, and they have come back for a second or a third baby even. So, you know, there is no limit on how many numbers you can go through. It depends on their own emotional state as well, and financial state, and of course on what is causing them not to get pregnant, and whether we can give them an alternative way of going forward without them having to go through quite a few numbers of IVF.
Thank you, Saghar. Thank you so much for speaking to me today.
Thank you very much for having me. Thank you.